Hello, I'm Dennis Holmes. It's a pleasure to join you today to discuss the impact of delay in treatment after a diagnosis of breast cancer. I'm a breast cancer surgeon and cancer researcher based in the Los Angeles area, and the impact of delay in treatment, particularly the impact of delay on survival, has been an area of great interest to me. I've looked to find solutions for this, and so I'd like to spend this time sharing with you not only the problem, but a solution that we had the opportunity to introduce and demonstrate in the context of a clinical trial, which I'll share with you by the end of the presentation. Now, as I said, I've been in practice for about 20 years, and one common theme across this experience is that anxiety related to a diagnosis or to the delay in treatment has been a great burden that many women have had to bear. They have to wait to have the biopsies performed. There's uncertainty about that. Once a diagnosis is made, there's this anxious wait until they undergo treatment. And a lot of that anxiety is shared by the physicians, myself and others, who want to get the patients through the process as efficiently as possible. Now, we've also had concerns over the years that those delays, particularly when the delays are significant, could sometimes impact their survival. It was a concern, a suspicion that we had, but we never really had hard proof that delays clearly, consistently compromise survival, at least not until 2015, when a colleague of mine, Richard Bleecker, published this paper along with his colleagues, looking at the time to surgery and breast cancer survival in the United States. This was published online in 2015. And what they did was to look at two national cancer databases, the SEER Medicare cohort database and the National Cancer Database, about 200,000 women with stage 1, stage 2, and non-inflammatory stage 3 breast cancer. And they looked at the time interval from the diagnosis of breast cancer by needle biopsy and the time of surgery to see if there was any correlation between delays in that interval and survival. This image here summarizes the key findings of the publication. Looking at the time from needle biopsy to surgery, the first finding was that beyond 2 months, each additional 1 month delay led to a 10 to 15% relative reduction in survival. So from 60 to 90 days, there was a 10 to 15% relative reduction in overall survival. From 90 to 120 days, there was an additional 10 to 15% reduction in overall survival. And the second finding was these reductions in survival were primarily seen in patients with stage 1 and stage 2 breast cancers. It wasn't the stage 3 breast cancers that where it was prominent. It was in the early stage breast cancer patients where time mattered most, where time delays correlated with worse survival. Now, since Bleecker published this paper, there were a number of other publications that came out, a good 24, that showed essentially the same thing, looking at different populations. There's one here from a universal healthcare system. So within a single system, they looked at time interval and its association with survival and found, again, that prolongation of the time interval between biopsy and surgery led to a compromise in overall survival. Studies also looked at the impact of age. It was also true for young women, just as it was for older women. And then more recently, Deborah Pratt and colleagues looked at the time of completion of breast cancer treatment and survival, looking at the interval between surgery and completion of chemotherapy for patients that are receiving chemotherapy, surgery, and radiotherapy, for example. The point was that the total treatment interval from the start of the treatment, surgery, and the completion of adjuvant therapy had a correlation with survival. When that interval exceeded 38 weeks, or about 8 months, there was a 6.5% reduction in survival amongst those patients. So efficient care mattered. It was important to get it started, but it was also important to complete it in a timely manner because delays in the completion, according to this publication, also compromise survival. This study is actually a meta-analysis. It looked at all of the publications up to 2020, all of the publications for breast cancer, but other cancers that correlated time to treatment and survival, and found consistently that time to treatment mattered for a range of cancers. Our focus here is on breast cancer, but this publication looked at bladder cancer, colorectal cancer, head and neck cancer, and others. And there was a consistent finding that the time from diagnosis to surgery mattered, and the time from surgery to completion or surgery to initiation of adjuvant therapy mattered. So time matters even in terms of survival for patients diagnosed with breast cancer or being worked up for breast cancer. This publication, just for completeness, was actually a publication that looked at the time interval from an abnormal mammogram, like a suspicious finding, to the time of a biopsy for someone who was ultimately diagnosed with breast cancer. And specifically for patients with breast cancer, it found that when the interval between an abnormal mammogram and a biopsy exceeded 90 days, there was a 20% relative reduction in survival for patients diagnosed with breast cancer. So time matters yet again. So why does this matter, and to what degree does it matter? Well, in order to understand the impact of these delays in a kind of a real world sense, you have to understand, take a look at the impact of the things that we do to improve survival. For example, we give chemotherapy to improve survival, to reduce the risk of death. We give endocrine therapy to reduce the risk of death. There have been a number of studies looking at, the global experience of giving chemotherapy, the global experience giving anti-estrogen therapy, and each of those studies show that chemotherapy reduces the relative risk of death by 30%. That hormonal therapy reduces the risk of death by about 30%. It'd be nice if it were greater, but the reality is the relative reduction is about 30%. So to understand what that means is if your 10-year survival for breast cancer would be 10% without chemotherapy, and we give you chemotherapy, a 30% reduction in your mortality would be a reduction from 10% to 7%. It's a 3% absolute reduction, but it's a 30% relative reduction. Or if you went from 10 to 5, that's a 5% absolute reduction, but a 50% relative reduction. So what you get with chemotherapy is a 30% relative reduction, or you get from hormonal therapy a 30% relative reduction. So let's see how that stacks up against the negative impact of the delay of survival. So based on the Bleecker publication, a 90-day delay, that it means 60 days plus an additional 30 days, is associated with a 10% to 15% relative reduction in overall survival. If the delay is as long as 120 days, there's another 10 to 15% reduction in relative overall survival. If the magnitude of chemotherapy is 30% benefit, and the detriment or the harm of a delay is a 10 to 15 plus 10 to 15 compromise of survival, you can see how the impact of a 120-day delay would completely or almost completely negate the positive benefits of chemotherapy or the positive benefits of hormonal therapy. So essentially, we're giving patients chemotherapy to make up for the fact that we delay their care often and compromise the survival by the delay. It's almost unethical to think that you can give someone systemic chemotherapy, which has considerable potential harm, when there's no benefit potentially if the patient's care has been delayed by 60 to 90 days because of the challenges that the system sometimes imposes to get patients with treatment. So time matters, and if we want to maximize the benefit of chemotherapy and endocrine therapy, we have to minimize the negative impact of delays that compromise the value and the benefits of those treatments.